Vaccination is one of those words that can make pet owners nervous, sometimes even more nervous than the dogs and cats themselves. But vaccines are not about fear. They're about protection. They help support your pet's immune system and give them a safer chance to enjoy walks, travel, meeting other animals, and everyday life without unnecessary risk from dangerous infections. And here's something important. Vaccines are not only for pets that go outside every day. Even if your dog or cat lives indoors, the risk is still there. Viruses and bacteria can be brought into the home on shoes, clothes, hands, objects, insects, or through contact with another animal. Sometimes all it takes is one quick escape into the hallway, contact with a contaminated surface, or meeting an animal that looks perfectly healthy but is carrying an infection. Today, we'll talk about why dogs and cats need vaccines, what diseases they're commonly vaccinated against, why the schedule matters, and what to remember before and after vaccination.
Hi, you're watching Giraffe. Today we're talking about pet vaccinations, calmly, clearly, and without fear-mongering. The goal is not to scare you, but to explain why vaccines are considered a basic part of responsible pet care.
Let's start with the biggest question. Why vaccinate a pet that barely goes outside? Because infections don't care whether your pet goes for walks or not. Germs can enter your home in many ways. On the soles of your shoes, on clothing, on hands, on things brought in from outside or through other animals. Dogs and cats can get diseases that become very serious very quickly. Some are especially dangerous for puppies, kittens, senior pets, and animals with weaker immune systems. Vaccination helps the body recognize certain infections ahead of time and prepare an immune response. So if your pet comes across that infection later in real life, their body has a much better chance of fighting it.
In simple terms, a vaccine doesn't mean your pet will never encounter an infection. It means their immune system gets a head start.
Let's start with dogs. Puppies are especially vulnerable. Their immune system is still developing, and the world around them is big, exciting, and not always safe. As a dog grows, they start going outside, meeting other animals, sniffing grass, sidewalks, entryways, shoes, toys, basically everything that looks interesting. And with that comes the risk of exposure to infections. Dogs are commonly vaccinated against several serious diseases. These may include canine distemper, parvovirus, infectious hepatitis, leptospirosis, parainfluenza, adenovirus infections, and rabies. Some of these illnesses can progress very fast. Parvovirus, for example, is especially dangerous for puppies and can lead to severe dehydration in a short amount of time. Leptospirosis is also important because it can spread to humans. And rabies is one of the most serious diseases of all, because once symptoms appear, it is almost always fatal. That's why rabies vaccination matters so much.
That's why vaccination is not just better safe than sorry. It protects against diseases that are far better prevented than treated.
Rabies deserves special attention. It's dangerous for both animals and people. Infection can happen through a bite, saliva, broken skin, or mucous membranes. Once clinical signs appear, rabies cannot be cured, so prevention is absolutely essential. In many countries, rabies vaccination is required by law or strictly regulated. Proof of vaccination may also be needed for travel, events, grooming salons, pet hotels, or crossing borders. Usually, rabies vaccination is recorded in your pet's veterinary passport or vaccination record.
If you're planning to travel with your dog or cat, check the rules ahead of time. Requirements can vary depending on the country, region, airline, or type of transport.
Now let's talk about the vaccination schedule. Puppies usually start vaccines at a young age. Then they need follow-up doses to build a stronger immune response. After that, regular boosters are needed to keep protection up to date. But the exact schedule should always be set by a veterinarian. They'll take into account your pet's age, health, lifestyle, region, risk of contact with other animals, and any vaccines your pet has already received. If you found a puppy on the street, adopted one from a shelter, or simply don't know their vaccination history, it's safest to assume they may not be fully protected and discuss the right plan with your vet. It's also important to remember that immunity does not develop instantly. After vaccination, the body needs time to build protection. So during the first few weeks after vaccination, puppies are usually kept a little more protected. No overexertion, no dog parks, no close contact with unfamiliar animals, and no unnecessary stress.
And for a vaccine to do its job properly, timing is only one part of the story. Your pet also needs to be ready for the appointment. So what should you check before going to the vet?
Before vaccination, your pet needs to be properly prepared. They should be clinically healthy, active, eating normally, and showing no fever, vomiting, diarrhea, coughing, unusual weakness, or other concerning symptoms. Before giving the vaccine, the veterinarian examines the animal and decides whether vaccination is safe that day. Your vet may also recommend parasite control before vaccination. That matters because parasites can put stress on the body and affect your pet's overall condition. Don't give medications just in case right before vaccination unless your veterinarian has told you to.
The basic rule is simple. We vaccinate healthy animals. If your pet seems weak, isn't eating well, or has digestive problems, deal with that first. Then talk about vaccination.
Now let's move on to cats. There's a common myth that indoor cats don't need vaccines because they never go outside. But that's not completely true. Even an indoor cat can be exposed indirectly through shoes, clothes, a carrier, items brought in from outside, contact with another animal, or one unexpected escape from the apartment. Cats are commonly vaccinated against rabies, feline viral rhinotracheitis, panleukopenia, and calicivirus. These infections can be very serious. Panleukopenia, often called feline distemper, is especially dangerous for kittens. Calicivirus and rhinotracheitis can spread quickly and can be hard on cats, especially those that are young, older, or already weakened. Some cats may carry infections while looking mostly normal and still infect other cats.
An indoor lifestyle lowers the risk, but it doesn't remove it completely. So vaccines are not only for outdoor cats.
A cat's vaccination schedule, just like a dog's, depends on age, health, and vaccination history. Kittens are usually vaccinated according to a schedule set by a veterinarian. Then they need boosters and regular updates to maintain protection. If you took in a kitten from the street, adopted one from a shelter, or you simply don't know whether they were vaccinated, don't guess. See a veterinarian, get an exam, and build a safe vaccination plan. It's especially important not to vaccinate an animal that is clearly sick. The vet should evaluate the pet first.
Okay, the vaccine is done. What happens next? It's important to know which reactions can be normal and when you shouldn't wait before calling the vet.
After a vaccine, a dog or cat may have a mild reaction. Your pet might be a little sleepy, play less, or eat less for a short time. Sometimes there may be mild soreness or a small lump where the injection was given. That kind of reaction is often considered acceptable, but you should still keep an eye on your pet. After vaccination, it's best not to bathe your pet. Avoid intense play, don't suddenly change their routine, avoid unnecessary travel, and don't introduce them to lots of new animals right away. Also, don't give any medication unless your veterinarian has approved it.
After a vaccine, your pet needs a calm routine. Not because they're weak, but because their immune system is doing its job.
It's also important to know when to contact a veterinarian right away. If your pet develops severe weakness, trouble breathing, swelling of the face, vomiting, severe diarrhea, seizures, a high fever, strong pain, a serious allergic reaction, or their condition gets worse quickly, don't wait. In that situation, contact a veterinarian immediately or go to a clinic. These reactions are not common, but every pet owner should know what to watch for.
If everything went smoothly after the vaccine, that's great. But remember, one vaccine usually doesn't protect your pet for life. Protection needs to be updated.
Here's another important point. Vaccination is not usually a one-time thing. Protection can decrease over time, so pets need booster shots. How often they need them depends on the specific vaccine, local laws, your pet's lifestyle, and your veterinarian's recommendations. For some pets, a standard schedule is enough. For others, for example, pets that travel often, attend shows, visit grooming salons, live in higher-risk areas, or have frequent contact with other animals, the schedule may be different.
The easiest way to stay on track is not to keep everything in your head. Keep a vaccination record or veterinary passport, and mark the date of the next vaccine in advance.
Here's a quick checklist before vaccination. Your pet should be healthy. A veterinarian should examine your pet before the shot. Vaccination history should be recorded in a veterinary passport or medical record. If you don't know whether your pet has been vaccinated, ask your vet how to safely start the schedule. Don't give medication without veterinary guidance. Ask whether parasite control is needed before vaccination. After the vaccine, keep your pet calm and comfortable. Watch their condition during the first hours and days. And if there is a strong reaction or your pet suddenly gets worse, contact a veterinarian immediately.
Here on Pan Giraffe, we believe in calm, thoughtful pet care. Vaccination is not something to panic about. It's a practical tool that helps your pet live more safely.
Vaccination is part of responsible pet ownership. It doesn't matter whether your pet lives in an apartment, goes for daily walks, visits the countryside, or almost never leaves home. The risks may be different, but basic protection still matters. Timely vaccines help reduce the risk of serious infections, protect your pet's health, and in the case of rabies, help protect people too. They can also be important for travel, visits to certain facilities, contact with other animals, and simply living with more peace of mind. A vaccine is not just a stamp in a passport. It's care. It's prevention. It's a way to act before a serious problem happens.
Subscribe to Pan Giraffe if you want more clear, practical videos about pet health, care, and life with animals. Write in the comments when your pet had their last vaccine and whether you keep a vaccination record. See you in the next video.